Hi, please be very welcome to the Visão Hospitalar magazine channel. Today we are going to have an interview with Ronald Lavater, the CEO of the International Hospital Federation. Ronald, please be very welcome here to our interview. Introducing yourself, please, and your journey and trajectory, please, if you can summarize it, because I know it's extensive.
So my name is Ron Lavater. I'm the CEO of the International Hospital Federation. I've been part of the International Hospital Federation for 4 years, and I'm excited to be here in Rio for our 47th World Hospital Congress. I'm a hospital administrator by training, and for over 25 years, I ran hospitals in the United States as well as in the Middle East. And 4 years ago, I had the fortunate opportunity to talk to a board member at IHF, which allowed me to put my name in the hat for the CEO role. And so I moved my family to Geneva, and I've been very happy ever since running the International Hospital Federation. The journey to Rio for us for the 47th World Hospital Congress was one that started over a year and a half ago, talking to Dr. Morato and Louise at FBH about returning Congress back to Brazil. We had the fortunate pleasure to have Congress in 2009 here in Rio. It was extremely successful, but 15 years is too long, and so it was time to come back to Rio. FBH is a strong member of IHF, has been a strong member for decades, and we knew that the healthcare delivery system here in Brazil had a lot to share with the global audience with the World Hospital Congress. World Hospital Congress brings hospital executives and healthcare executives from around the world. This Congress, we had over 1,300 hospital leaders and healthcare leaders from 65 countries that come together for 2.5 days to learn and exchange, share ideas, share challenges, talk about the solutions on the topics that are important to them today.
The major challenge this Congress in Brazil brought here for you and the organizations?
Sure. When you talk to hospital leaders across the globe, a common challenge that you hear, and if it doesn't rank as number one, it's certainly in the top 3 challenges for hospital leaders, and it's really the workforce. There's a workforce shortage in healthcare. Coming out of the pandemic now, we've seen that we don't have the number of healthcare professionals, doctors, nurses, technicians, even part of the administrative teams in these hospitals. We don't have enough trained workforce to meet the need, the demand. And this is in countries from Belgium to the United States, to Brazil, to Japan, across the world. So this is a common challenge that the hospital leaders are facing within the IHF network.
So next Congress is going to be in Switzerland, and we want to ask you which learnings you are taking from here that you are going to use in Switzerland for the next Congress.
Well, I'll tell you, we've had a lot of great learnings here, and there's a couple topics that we explored here that we'll definitely bring over to Geneva. One is the use of artificial intelligence, AI, in healthcare delivery. So AI is happening in so many different elements of the whole ecosystem, from administrative operations to patient interactions to make it smoother for patients to enter the healthcare system, to actually even clinical care using the use of AI. So I don't see that topic going away. I see it actually a bigger part of our Congress in the Geneva market. And we've had some really interesting, intellectually stimulating, and also very informative discussions in our Rio Congress.
Nice. First of all, we thank your participation here. We want to ask you for a last message, because this message is going to reach people that are working for hospital, that are entities, are references for healthcare. So please, if you wanted to leave any message.
Well, I mean, I'd like to leave the message that hospitals and health service delivery organizations rely on the leadership to set the tone and to drive the organization forward for the benefit of the patients in the community. And it's somewhat simple to say it's about leadership, but it really does come down to that. And what IHF is committed to is helping hospital leaders and health service leaders across our network do their job better, which then impacts their communities and the health of the population that they're taking care of. So I have a lot of respect for the people that work in the industry, and I just want to thank them for all the hard work that they do, and we're just happy to be part of it.
Now, please, Ronald, we want to thank you for the participation in the podcast. We want to thank you for watching.